Hello, Dr. Dsouza here from District Center for Integrative Medicine. I am excited to share a case with you, and my intention in doing so is to highlight what an experience is like at DCIM and highlight how it might be different than what you're used to in your more conventional medical practice. So this is the story of a 63-year-old woman who has unfortunately struggled with lifelong anxiety. If we start with the symptoms, she described that she felt an unrelenting sense of worry about both the things that were reasonable to worry about, but mostly about things that she kind of objectively knew were safe things. She had insomnia, so she had trouble falling asleep and staying asleep, and she had physical symptoms of hyperarousal, like an elevated pulse, high blood pressure, and a sense of irritability. And she just had this incredible plea, I can't go on feeling this way, right? I can't live my life. I have no quality of life. I objectively have a wonderful family and grandkids, and yet I can't enjoy any of it. So she tried many things, right? She was committed to her care. For over 30 years, she tried multiple different things. She was in psychotherapy. She was on more than 10 different psychotropic medications, and either they didn't work or they were incredibly cumbersome from a side effect profile perspective. And she actually was hospitalized twice for very high anxiety. Now, one of the things that was different from the get-go when she came was this 1.5-hour intake appointment where there was a deep listening for just the inflection points in her history. And it became very clear that she had led a very traumatic life, and that was affecting her nervous system and how reactive it was. Instead of thinking primarily about using a psychotropic medication, we also concurrently looked at what is her hormone function like? What nutrients is she deficient in? How does her microbiome, her gastrointestinal function, play into what type of inflammatory signals are being sent to her brain? And the other thing that we were able to tease out in taking the history and looking at her medication list is the fact that many of the medications that she was taking to manage her symptoms were actually part of the problem. One of the tests that we did was for something called cortisol. And cortisol is a hormone that is secreted from your adrenal glands. It is something that we need and is favorable when it's working well, but when it's out of balance and is reactive constantly to the environment, it will lead to symptoms of anxiety, as an example. And as you can see, if you look at the graphic here, she had an incredibly high cortisol state. She was outside of 2 standard deviations away from the mean. This was really impactful for us, right? It both kind of validated her experience, but it also allowed us to look more comprehensively at ways to support her that didn't just include thinking about pharmaceuticals. So as we were able to make a new treatment plan that was individualized for her, we added amygdala retraining. And the idea with amygdala retraining is it helps a reactive brain that has been exposed to trauma learn how to modulate and see the world that is actually in front of them that happens to be safe. We also started taking away medications that were not serving her and added in some adaptogenic herbs. Ashwagandha is one of them that help bring down and balance that cortisol response, and emphasize to her the importance of doing compensatory meditation. So meditation activates that parasympathetic part of your nervous system, the part of the nervous system that is responsible for calming, for relaxation, for a sense of safety, and that was part of her daily routine. And in honoring this kind of trauma history, we were able to recognize how the root cause for her was this just over-exaggerated fight or flight response that was causing massive levels of cortisol to be secreted. And while this is a case that is still ongoing, one of the things that's really exciting is that she is doing so much better and feels incredibly heard. So I hope this is helpful in allowing you to see what it can be like in a more clinical context, how a comprehensive experience can really serve you and allow you to be seen, but also help integrate many more tools than just pharmaceuticals. I wish you well in whatever healing journey you are on. Take care.